We talked about hospitals earlier. They now occupy that biggest percentage of the healthcare dollar. Insurance, though, cannot go unmentioned. When I redesigned my plan to make it to where we haven't had premium increases in 15 years, through the kitchen sink and everything at wellness, created healthcare consumers at the time, insurance was never intended to take care of minor health care. Just like it doesn't work in any other area of insurance, it's for indemnification of a critical, unusual incident or issue. I don't think it was ever intended, it's evolved that way, to cover everything. Do we need insurance for primary health care, or should it go back to what it was intended for, indemnification against critical illness or an accident? I want to start with Dr. Fiedler. And why is that still a part of the system? It's kind of like the Darth Vader that keeps the glue of lack of transparency and everything there. And then Dr. Daphne and Dr. Caroz. So keep your answers at about a minute or so we respect the time. Dr. Fiedler, you can start.
So I think one of the rationales for coverage of some of these more routine services is that they have the potential to prevent the need for more expensive services down the road. And so I think
prevention is worth, an ounce of that is worth a pound of cure.
Right, and it may not be that they're cost saving, but it may be that the sort of benefits they provide together with the cost savings they generate means they're worth it on net. So I think that is
But that doesn't work in any other arena of insurance on minor stuff. Then you're mixing indemnification and the cash flow that goes with it, and you're doing other things to where, why couldn't that be done directly between patient and the provider and get rid of all the red tape and cost of processing a claim?
So I think another important reason that many of these services are being covered through insurance is because the insurer is actually playing a very important price negotiation function in the private market.
So I want to stop there. You've made your point. I think that is totally off base. You've gotten rid of what works in every other market. People shop around to save 50 bucks on a big screen TV. They're not doing any of that. When I put that into my insurance plan, costs started going down by 50%. You throw the wellness tools, you have your cake and eat it too. Dr. Daphne.
Thank you for the opportunity, Senator Braun, to answer this question. I agree with you that insurance ideally does not have first dollar coverage, right? It's supposed to protect against the unanticipable risks that one has. However, what data show us is that when consumers have high deductibles, that they cut back on their care, but they cut back indiscriminately. They cut back on care that could reduce spending later on, and to the extent that employers and government payers then end up having to spend more because of those decisions early on, that's a reason to subsidize that kind of care.
To me, your question, at least in part, and I'll see if you agree, raises the question of how should primary care be compensated, and it seems like when you're moving away from the purpose of insurance as you described it, you could think about capitated models of payment for primary care that gives you a predictability in what the cost is. Exactly how that gets funded and what the incentives are for patients is sort of a different question, but I think that the cost of primary care should be relatively predictable, and that paying prospectively on a per member per month, per member per year basis for primary care makes sense. One of the things that I would add is that I think there is value in having primary care have skin in the game in terms of managing total cost of care, because I believe that they play an important role in that, although they can't do it alone.
I think that is the dilemma, because you do then eliminate the market and that skin in the game, and we've evolved that way. All I can tell you is I'm seeing more and more, unless you're saying people would not take care of their own well-being just because that's the way it's been, I think you're sticking to a model that's broken and that has gotten us where we are today. We need to get creative there. You bring healthcare costs down. I did it, and it's been working for 15 years, and we got to be more creative, entrepreneurial in areas like that. Mr. Merkel, you want to weigh in quickly?
Yes, I would say that you're right. Insurers' raison d'etre is to insure against financial risk, and to the extent that we have required them to do more, they do that inefficiently. And while, yes, currently they're playing a role to negotiate prices, I think that they haven't done that particularly well. And if we put more people, put more pressure on through giving consumers and patients and providers more active role in doing that, I think we'd probably see better results in the long run.